Jess, it's just ticked over 7:04 and we've got 250 people waiting patiently to hear some amazing stories from you about whether walking is enough. So if you're okay, we might kick off. So welcome everybody to another Keys webinar series. These have been increasingly popular over the last couple of months, both in Melbourne, where Keys has most of our clinics, but also right through New South Wales and Queensland, where we've recently set up as well. So to everybody all across the country, thank you for joining. Look forward to having a really good chat with you tonight. Jess, whom I will introduce in a second, is going to run through a bit of a presentation about whether walking is enough. And I'm going to moderate all of your questions. And I'm hoping that they come thick and fast and they're really hard and difficult. And I can pass them straight through to Jess. That would really make my night. So feel free to throw as many questions as you possibly can down the bottom in Q&A. And Jess and I will do my best to pass them on to Jess, but I'll make them time specific as well. So I'll try and join in when it's an appropriate slide. Anything that Jess isn't able to answer, Jess and I have a little bit of a chat after we're finished, and we'll make sure we tick off all of the questions. So with no further ado, I'd like to introduce Jess Bygate, or you'll probably hear me refer to Jess as JB throughout this presentation. Jess is our clinic leader at Keys Caulfield, and Jess has an exercise science degree. But what some of you may not know about Jess is that Jess is also a former elite sportswoman. And so having played basketball for multiple different clubs, both here and in New Zealand, she was worked hard enough and successful enough to win a bronze medal at the Commonwealth Games in 2018, JB?
Nice, nailed it.
2018, had to remember my Olympic years compared to my Commonwealth Games years. So Jess not only brings a wealth of experience from an elite sports background, but also brings it from an exercise science background as well. And this question of is walking enough is certainly one that I get quite a bit as a physiotherapist. And JB, I'm sure you've had plenty of times as an exercise scientist, and also holds really strong relevance now, given that some people may not have the access to exercise that they have previously. So Jess, the floor is all yours, and I'll monitor really closely for everybody's questions. So if anything comes up, I'll be sure to pop my head in and ask you a question.
Awesome. Thank you, Tim. Hello, everybody. I'm really excited to talk to you all tonight about something's become quite topical over the last really 6 months due to COVID-19. We've been quite restricted. So let's just dive in. Is walking enough? Tonight, I'm going to cover the National Physical Activity Guidelines, some frightening facts, cover some research studies, increased sitting time, what that means, physical activity recommendations for some common conditions, key take-home messages, and then some questions. If I don't answer it throughout, we'll touch on some at the end as well. So our National Physical Activity Guidelines for Australian adults are 150 to 300 minutes of moderate intensity physical activity per week. If you're wanting to work a bit harder, only doing 75 to 150 minutes is required, as well as doing 2 days per week of muscle strengthening activities. It also notes that sedentary behaviour isn't great, so we want to try and sit as not as much as possible, and we want to break that up as often as we possibly can as well. So the guidelines mention moderate and vigorous. To gauge what intensity you're working at, there's an easy way called the talk test. So low intensity could be where you can talk and sing and breathe normally. So this is like your coffee shop stroll. Moderate intensity is when you can talk but not sing. So you're working a little bit harder. So it's like your ISO walk gas bag with a friend or loved one. Vigorous intensity is when you're working a little bit harder here. So you can say more than you can't say more than a few words without having to take a big breath. So someone gave you a call and be, hey, I need to call you back. I'm in the zone here. I'm working pretty hard. I'm getting a bit puffed. I'll call you right back. So it's a lot harder here with that intensity. Throughout the presentation, I am not going to just do all the talking. I want you to start thinking about some of the information that I'm presenting to you. So for the firstly, I'd like you to think about the last walk or activity that you did, perhaps today. And now, after knowing these intensity scales, what would you rate that exercise? So the question that's all brought us here tonight is walking enough? Essentially, the answer is no. Walking is really, really good, but alone it does not tick all the boxes that we need for our health. As a recommendation stated before, 2 strength training sessions, as well as getting into the moderate or even vigorous, is really, really good for us. What I am going to teach you tonight, though, is how we can build on this really good walking that we've all been doing and what other things we can add and incorporate within our routine. Before I do that, I want to add to some frightening facts. Half of us do not meet any of the physical activity guidelines. So not doing the strength, not doing the minutes of our walking or activity, it's not very much. Only 23% meet the guidelines for 2 strength sessions per week. So again, pretty slim. Only 15% meet both physical activity and strength guidelines. So not many at all. And lastly, 75% of females and 69% of males over the age of 65 are insufficiently active. Pretty frightening. I want you to pause again for a moment. Think about how long, how often you're doing strength exercises, physical activity. Are you meeting these guidelines and are you meeting them consistently?
JB,
Yeah.
we've got a question on intensity that I think is a really good one. So what if I want to exercise intensely, but my body won't allow me to?
So if your body won't allow you to, it's working out why it won't allow you to, whether there's something that's impinged or some lack of strength somewhere that we can improve on to then move towards that vigorous state. That's what my suggestion would be. I do touch on it a little bit later around different exercises. Moderate is still really good. Vigorous is probably better. It's working from getting the low up to more of the higher.
Yeah, I think that there would be quite a few people out there that would be limited in their ability, whether it be through pain or some other type of chronic disease. And in that situation, you just may not be able to get the intensity, the moderate intensity that we would like. And that's just part and parcel of it. So what we need to do is find an intensity that you are able to exercise at, or perhaps find an alternative mode of exercise that's not walking. And if we're talking cardiovascular exercise, that might be, walking in a pool because it's non-weight bearing. But I know, JB, that you're going to touch on other types of exercise later on as well.
Yeah, so it actually brings nicely to this next slide around some different ideas. So like Tim said, if you can't, walk fast or run and get into that vigorous exercise, swimming at a higher intensity or fast cycling can get you into that vigorous state. Cycling's a good one. It's non-weight bearing. You can kind of work through that without the impact. Tennis could be an option for getting more moderate if you're struggling to get out of that low zone as well. Physical activity ideas in regards to the strength training, as well as our resistance exercises, resistance bands, weights, other strength exercises as well. So this kind of gives you a little bit of, context of some ideas around those ones. So I don't know if you all know, but we have a bit of a celebrity among us. So Tim has actually been on the Today Show quite a bit. but recently discussing walking and specifically talked about volume and intensity. So just thought I'd put a nice big picture of Tim there, and I'm sure that he's very happy about that one.
Yeah, thanks, JB. That's a great stitch up. Well played. I'm definitely passing all of the tough questions through now. I'm not screening anything anymore. I'm just going to throw them straight to you. We do have a question on age, JB. So whether these physical activity guidelines and the talk test that you spoke about applies to 25-year-olds, 50-year-olds, and 80-year-olds the same.
So the talk test is all relevant to you and where you're at. I know for myself, I've been in different levels of fitness. Right before Com Games, I'm at peak fitness. Currently, I've had a knee injury recently in surgery, so I'm a little bit lower. So what I can talk or even sing at is going to be quite a bit different from that peak fitness versus where I'm at now. So that kind of contributes as we age as well. Someone who's an older adult is going to find it harder to breathe maybe by just walking around the block. Whereas for someone who's younger or more fitter, that's going to be in the low category for them. So it's working out just where you're at, and that will change. The walk around the block with a hill might be in that moderate for you at the moment, but if you're building up your fitness and strength as well, that'll change maybe to more of a lower intensity for you. So I hope that answers. It is sort of a changeable thing. So back to the studies Tim talked about on the Today Show. He talked about a study where participants wore devices like Fitbits and track steps. So it was really interesting to show the difference between two groups. One who walked, so they both walked the same volume, but one group walked at a higher intensity and one group walked at a lower intensity. What the research found is that the group that walked at the higher intensity had greater reductions in mortality than the group that walked for the same volume but lower intensity. So essentially, trying to increase higher volume of higher intensity equals that reduced mortality. Another factor inhibiting us, particularly during some of these restrictions, is increased sitting time. What used to be the walk around the shops, walk to the train, standing up at a barbecue, those kinds of things, it's recently been a lot less, particularly for us in Melbourne. You can see by the diagram here how quickly sitting time can add up, and even more during the last 6 months. If you sit for 11 hours a day, your risk of early death is 40% higher than someone who sits for less than 8 hours a day. So again, if you sit for 11 hours a day, your risk of early death is 40% higher than someone who sits for less than 8 hours a day. So that's pretty crazy stat there. Again, let's just all take a moment. I want you to think about how long you sat for today. Add that up. If you're game, pop it in the chat and tell me whether you're surprised by this number or not. I know sometimes on the weekend it adds up, and it can be quite scary if you really think about how many episodes you've been watching or different things like that. So while you're having a think about how long you've been sitting for, I'll give you a few little tips on how to break up that sitting time. So doing things like cleaning and tidying, a good time for a spring clean, you're up and about moving around. Cooking or baking, I've been doing a bit of this lately, so good result getting something tasty, but you're also standing and moving while you're doing these activities. Getting outside in the sun, doing a bit of gardening. And the next one is one of my favourite hot tips from E. McKean, one of our physios in South Melbourne. So her tip is to drink more water. So basically drinking more water, we're nice and hydrated, but we're going to have to get up and go to the bathroom more. So breaking up that time at the desk, having to move around a little bit more as well. So that was a really good one. Okay, so we know about our physical activity guidelines. We know there's low, moderate and high forms of activity. We also know that sitting isn't great for us. What about walking? It is really good for increased cardiovascular and respiratory fitness. It's a good tick. Good way to improve management of conditions such as hypertension or high cholesterol. Decreased risk of heart disease, diabetes and strokes. Helps reduce body fat. Increased levels of energy levels, and improve psychological well-being. I know getting out in the sun, going for a bit of a walk is a good mood booster. And it's also a good way to boost immune system. I've also included a few hot tips. Like I mentioned briefly, I did have knee surgery just over 4 months ago. So it's been limiting me from doing my normal vigorous exercise like my basketball or running. So I've taken up quite a lot of walking, and I've been really finding ways to make it vigorous. I've really tried, or make it a bit more fun as well. So I've got a few tips to help with walking as well. So a good one is pre-planning whether it's going to be a fresh air walk or an exercise walk. If you are trying to get in that moderate state, thinking about it before and going into that walk, okay, I need to get into that zone. Dress for the occasion. So I've got a good demo down there, and that's what Tim wears when he goes out on his walks. But in all seriousness, dressing for the occasion, meaning popping on your active wear, wearing the correct footwear, sunny, having a visor, making sure you're prepared and you're in the zone to perform essentially the best you can. Warm up, so dynamic stretch. Again, if you're trying to go straight out of the gates with that fast walking, it's not great. It can pull a muscle and do things like that. So doing a hip flexor stretch, some calf raises, some lunges, that sort of movement, making sure those muscles are nice and warm before we really start to push it. Track your progress. So I've been using Strava. For those who don't know what that is, it's an app where it records your time and distance, and it has a little map. It's quite fun. At Keza, we've also at the moment been doing a run or walk around Australia to raise money for breast cancer. So really, really good cause, and it's been increasingly motivating to get out and log some kilometres there. So if you do want some more information on that, we'll make sure that is available to everybody.
Yes, just touching on Strava for a second, because I think that in 2020 in particular, we don't need to just talk about physical, mental health is important as well. What do you think of the social benefits of a platform like Strava? And do you want to just talk to people a little bit about that? Because I know you guys and your team at Caulfield, who aren't quite as fast and maybe don't quite run as far as what we do up in New South Wales, but you still have some pretty good banter down there amongst your team, which I think must be really important at the moment.
Yeah, it really is. Again, those that don't know, Strava pops up your little map and you can add photos, you can comment on it and give kudos. So it is really motivating, and our whole team's joined and you can see where they've run and give them a bit of a shout out. We've got Georgia, who's always got a dog and pictures, and other people trying to run different random, make little pictures with the Strava route. So it is a bit of fun, and it provides a bit of banter for us all as well, which it's sort of like, oh, you've only done 1K, or, oh, come on, you've done 10, well done. Or, that is quite fun. It's really motivating as well.
Yeah, I think such an important motivating tool. My brothers are in country Victoria at the moment, and really one of the few ways that we do continue to connect is through looking at each other's Strava accounts and seeing where each other has run and ride and stuff like that. And I think that's really important for us this year in particular.
It's the accountability as well. So knowing that someone, you've got to log your run or your activity for the day or that sides of things, or just seeing where people are running. Todd, our team member, he's been running along the beach with his son in the pushchair. So it's pretty cool to see all those runs and stuff as well. So no, it is pretty fun.
JB, got a question on warm up from Anne. Anne wants to know, can you start off moderately fast and speed up as you warm up? Should you start off really slow? Can you just go bang straight into it? So could you touch on that for us?
Yeah. Look, it really depends on how fast or how intense you're really trying to get to. Absolutely, starting a little bit slower and building into it's absolutely fine. I've found that, especially more so for a Strava thing, when I push go on the Strava, I really want to be hitting really a good pace. So doing those stretches right before you go really fast is good. But yeah, like you said, if you're wanting to build into that walk or run and then build out of it as well for a bit of a cool down. I'll carry on. So kind of more so on the intensity side of it as well, stairs and hills are harder. So if you are trying to push that heart rate and get that heart rate up a little bit higher, finding some stairs, finding some hills, working to that higher heart rate as well.
So if I'm walking flat, JB, and I hit some hills, of which there's plenty in Sydney, should I keep going at the same speed? Should I try and walk a little bit faster? Should I slow down? How should my speed be affected by stairs or hills?
Naturally, it's going to be a little bit slower than walking on the flat. Doing what you can manage. So if you are, if you're trying to go for your fastest time ever, working to a point that you can drive through, yeah, I guess it would naturally slow down. But if you're trying to go fast, trying to keep that pace up as best you can as you approach stairs or hills. Choosing an appropriate surface is also a pretty interesting thing. So what I mean by that is if you've had a stress fracture, not walking on concrete, if you're at risk of falls and trips and things, getting an even surface rather than, a path that has roots and trees and that sides of things. It also could mean if you're someone that walks around the same block every day, being aware of the camber of the road. So you might not know that it does tilt slightly. So if you're walking around that same loop every single day, clockwise every single time, over time that'll shift through our biomechanics and it will actually have a bit of impact on hips and different soreness. So just being aware of that, maybe walk the different way or try some different routes as well. Being aware of your foot strike and pushing through that big toe, as well as swinging the arm, so getting a little bit of momentum with that as well. Walking is really good, however, there is some limitations. To answer the main question tonight, it isn't enough. It's generally low to moderate. I've tried to get it into that vigorous. It is pretty tough. It's low load, low force, therefore less adaptations for our body.
JB, what if I carried some hand weights? So yeah. would that take me from moderate to high? Like, could I lift the intensity by a little bit or a lot?
It would lift the intensity. If you think about it, you're carrying more weight. You're having to lift, your arm up full through that movement with more resistance against it. Wearing something like a weight vest or a backpack with evenly distributed weights it could be a good idea to add on some weight as well, add on some resistance. It's still not as effective as other strength training methods, which I'll touch on a little bit later. It isn't effective walking for managing osteoporosis and osteopenia, unfortunately. Again, walking as a sole exercise is not quite enough to achieve our overall health. So this is another study here that touches on the feasibility and effectiveness of high intensity boxing training versus moderate intensity brisk walking with adults with abdominal obesity. So you can see by the stats down the bottom here, we've got quite a bit of difference between the reduced body fat as well as VO2 max scores. But also with the blood pressure, during high intensity training, your blood pressure and heart rate increases. This forces our blood vessels to sort of widen and become more elastic, which that kind of then flows to at rest. It's easier and there's less pressure that's exerted to transport our blood around the body. With moderate intensity walking, it's okay, but it doesn't quite put as much strain on those blood vessels, which means less long-term change, unfortunately. If walking isn't enough, what is? So strength training helps walking and walking helps strength training.
JB, can I jump in with a bit of a question here? And it might be a little bit less of a question. I'll try and join the answer to a couple together. Karen asked about weight bands being worn on the ankles, and Anne was talking about people carrying the shopping home from the supermarket. Both of which are really good ideas, but I think one of the things that is useful to understand is that cardiovascular exercise and strength training exercise are two very different things. And Jess is about to go into some strength training and where that's different and why it's beneficial. We naturally, as humans, try and join two things together. And we say, well, if I carry the shopping at the same time that I'm walking, am I doing strength training as well? Well, yeah, you are a little bit, but it doesn't replace what we're about to talk about in terms of strength training. So all of these ideas, hand weights, ankle weights, carrying the shopping, carrying a heavier backpack, all of them will increase your intensity a little bit because they increase your load, but they won't replace strength training because you can't do those same things perfectly simultaneously. They are slightly different. Your body responds and adapts to them differently as well. So it's probably not a question, JB, probably just finishing off a few of them that were coming up on the Q&A. Cool. I'll let you continue, sorry.
Cool, thank you. Yeah, so the strength training helps walking and walking helps strength training, like Tim alluded to there. Strength training is really good for some other things as well. So it's really good for improving bone mineral density to prevent and manage osteoporosis. It delays sarcopenia, so that is muscle wastage essentially as you age. So by 80 years of age, most people lose 20 to 40% of muscle mass from not doing enough strength training. It's a good way to manage blood pressure, blood sugars and cholesterol. Good way to prevent and control heart disease and type 2 diabetes. We can improve our posture, mobility and balance through strength training, which then will reduce the risk of falls and then ultimately maintain your independence as we age. Strength training isn't just lifting iron. By definition, it is an activity that makes your muscles work against force. So it could be things like your own body weight, resistance bands, weight machines, or household items. So big bag of potatoes, squatting with that, lifting up some milk bottles, using things around that's going to provide that extra force for you. There are some further recommendations for common conditions. So for hypertension or high blood pressure, doing 5 to 7 days per week of aerobic exercise, over 30 minutes a day of moderate intensity is what is recommended, as well as 2 to 3 days per week, and focusing on our larger muscle groups with this condition.
JB, do you have a time recommendation for strength training?
No. Well, if we think about our KESA programs, half an hour when we're working to fatigue and that sides of things. I don't particularly have an exact.
I think the answer there is that strength training, the results from strength training are more to do with intensity. And so if you train at a really high intensity, you're just not going to be able to train for that long. Now, what you could do is you could go to a traditional gym, stand around for 45 minutes and just lift weights for 5 of those, and you could be in there for an hour, but you're really only doing 5 minutes worth of work. And so there's no relationship between the minutes of work that you do in strength training and your results, or certainly not a volume relationship. We always work on a time frame of 30 minutes, recognizing that quite a few of our clients probably need to take a little bit longer. And so between 30 and 40 minutes would be a typical program. I think that if you're strength training longer than an hour, I would be asking some serious questions about your efficiency, because the more strength training you do, the more that less is more. So if you're getting better and better at strength training and you're doing 10 exercises, the answer isn't to do an 11th. The answer is to cut one out back to 9 and try and lift the intensity of those 9 exercises. So the results from strength training are very intensity specific. So I think that probably, we move away from time when it comes to strength training, move a little bit even more so towards intensity.
Yeah, cool. So another common condition is diabetes. So with this condition, there are a few other further recommendations. So 3 to 7 days per week of aerobic, of 150 minutes per week total of moderate, and getting into that vigorous intensity. Resistance training of 2 and even 3 sessions of getting into that higher, again, intensity, and working on that full fatigue and that larger muscle groups too. Particularly for diabetes, strength training really helps to absorb more glucose from the blood. It's a good way to increase lean muscle mass, increase the glucose storage in the muscles, and also improves insulin sensitivity. So really, really key things to manage diabetes. Another condition is osteoporosis, and I've touched on it a little bit throughout. With this condition, 4 to 5 days per week of moderate intensity, over 30 minutes a day, and weight-bearing exercise is a huge key with this one. So with this picture down the bottom, you can see the healthy bone, it's pretty dense, whereas the osteoporotic bone is a lot more porous. So within studies, it's shown that with weight-bearing exercise, with strength exercise, it increases the bone density, which then reduces the risk of fractures. So doing things like dancing, hiking, jogging, high impact aerobics, jumping rope are going to be really, really important to manage this condition.
Yes, this is one we've got a few questions on, this and then arthritis. So hopefully we can touch on osteoarthritis as well. So when walking, if I were carrying weights, would that be more help to me for my osteoporosis than just walking without weights?
It would, but like it sort of says here, having a more high impact, high velocity intensity would be better. Like it's definitely going to be better than not having any weights at all, but moving into that more higher intensity, getting that impact is what you're going to need. Whereas the walking is a lot lower impact than some of these other examples here.
So we really need to stress the bone, don't we? So when the bone bends or it absorbs a compressive load, then your bone's always remodeling. So if you do lots of that, then it will lay down more and more bone. So if you only stress it a little bit, there's no need for it to respond, which is why gradually over time, but at Keyser, we get people who have osteoporosis working quite hard and lifting heavy weights, and it's really safe for them to do it. And that's an important thing to understand about strength training, is the safety for all of these conditions. If it's done well, the risk of an adverse effect is really, really minimal. We'll do everything we can to try and minimize it. So yeah, it'll help with a little bit of weight, absolutely. It'll help being weight bearing too, but the more load you can get in strength training, the better.
Cool. I've included now some options that, we can help here at Keyser. So we have got the one-on-one assisted training sessions with the exercise sciences. So you can come and see me or the other team. Exercise physiologists, physios. We can help with home exercise programs, telehealth or teletraining. So doing that via Zoom, they're pretty fun. The exercise physiologist also can help with those common conditions a little bit more. So the osteoporosis, cardiac, and diabetes. So they're running group classes of that. In Metro Melbourne, we are limited just at the moment, but they'll be up very soon. So if you are interested in any of these or do need help with anything at all, please do reach out. We're here to help you. All right, so our key take-home messages. COVID-19 has led to more walking and less strength training. Walking is a really good form of exercise. However, it does have some limitations. Are you walking at that incorrect intensity? Remembering the talk test. The importance of reduced sitting time and breaking up those times throughout the day. The combination of both aerobic and resistance training is best practice. We really need both to have that overall health and well-being, especially within those common conditions. Walking for osteoporosis is not effective enough, including that strength training. Like Tim said, having that force against the bone is what's going to help manage that condition particularly. Got some homework for you. So if you're doing your physical activity minutes currently and your 2 strength sessions a week, I want you to pat yourself on the back. Well done, good job. If you're not, join Keiza, you'll be able to do some strength training there. If you're already doing Keiza, make sure you're doing walking and doing enough of it. If there's something that's impeding you, call your physio tomorrow. Get onto it first thing. We're here to help. So do remember that if there's anything at all throughout this presentation that you have further questions or think, okay, that applies to me. How do I fix it? How do I get better at it? Please reach out. Just popped a few other webinars coming up. So the lovely Sam Coombs is doing your first 5K. So, you know, you may be walking and interested in starting running. It's going to be a really good presentation for that. We've got Josh Bird with the back pain, and then we've got some bone health down a bit later in the year with Ben and Nicole.
So bone health is often one of our most popular webinars, which we've done online, and even when we were able to do it in person was one of our most popular as well. So anyone who's got osteoporosis, osteopenia, or is at risk of osteoporosis or osteopenia, definitely join in to Ben and Nicole's presentation. It was really well received last time, and it'll cover off all of those questions. And on Sam's, the next one coming up, we know, shoe sales, running shoe sales, walking shoe sales are going up at the moment right across the country because everybody's walking and running a little bit more. So if you want some guidelines about how to go from maybe no running at all to doing your first 5Ks, or just a little bit of walking and you want to integrate a little bit of running because of something Jess taught you tonight, then joining in on Sam's webinar and asking him a question would be a great idea. Now, JB, I've got 18 open questions here that you and I are going to go one for one on. So I'm going to give you a little bit of prep time. So first question that I wanted to get to was from Helen, who said, thanks for a great session. Before COVID, I was doing aqua aerobics, which I miss. We did a lot of weights in the pool. How does that differ from strength training at Keiza? I'll give you 30 seconds to think about the answer, JB, because I want to answer a question which was, wouldn't some of those higher intensity activities like dancing, jumping, skipping come with a higher risk of fractures for those with osteoporosis? And the answer simply is yes, they would. But this is all, and this is true of all forms of exercise, it's always risk versus reward. So going for a walk puts greater stress on your heart, and going for a run puts even more stress on your heart. So in theory, if you had a cardiovascular condition, your risk would go up, and so you might have a cardiac event. Now, the amount by which that risk goes up is less than the benefit conferred to you and your cardiovascular system by going for the walk. So in the osteoporosis case, if you have severe osteoporosis or if you have any form of osteoporosis, I do not recommend, and you don't do any running or skipping or anything like that, I absolutely do not recommend that you go out and start running and skipping tomorrow. And that's important for anyone here. The start of exercise needs to be the same. That's the highest risk time. So that's when we need to smoothly increase your activity. But if you've got osteoporosis and you've been doing strength training for the last 12 months and you've done a little bit of walking and you want to integrate a little bit of jogging into that exercise program, and after 3 months of a little bit of jogging, you want to go to a little bit of skipping, and after 3 months of a little bit of skipping, you want to go to jumping, then that can be managed safely. And so as long as you're doing it gradually, then on the risk reward continuum, the reward that you get from weight bearing higher intensity and higher velocity exercises is outweighed by the risk of fracture. So hopefully that answers that question, but it is a really important one. And JB, now I'll let you answer the one on aquarobics, and I'm going to spin through this list and
Can
find
you
out.
quickly repeat it? I couldn't find it on the list.
Before COVID, I was doing aquarobics. We did a lot of weights in the pool. How does this differ from strength training at Keyser?
Just the load that you're going to be able to get through the muscles. So with weights in the pool, I haven't done it myself, but I know that it's very hard to get a big weight within the pool. The pool's good because it's low impact. Within Keyser machines or other machines, you can load it up and you can get quite a high volume of that load that our force and can lift against, and therefore increase it over time as well. So increased load would be the main benefit from doing something other than in the pool, I would suggest.
Thank you, JB. Here's a straightforward one for you that you can hit quickly. What are my large muscle groups? That was from Angela Hunt.
Good. So that's like our lower limbs, so our quads and our hamstrings, our glutes. So those big muscle groups throughout there that are going to expend more energy as well while we're exercising.
Fantastic. A question from Sue, who was asking about, her question's about, is a spin bike appropriate for aerobic exercise?
Yep, absolutely. So I think it was in the one of the earlier sides of moderate or vigorous, some examples there. So getting on a spin bike, you can get the heart rate up pretty high, so you can get into those moderate and vigorous zones within a spin bike session.
JB, if I can't walk fast enough to get a high intensity workout, am I doomed?
Not doomed, but we've got to find ways to, if you can't walk faster, walking up a slight incline, finding some stairs that will increase it and make it harder without necessarily walking faster.
Yeah, and the research we presented from the UK, which was of 100,000 people, said that the benefits of low to moderate intensity walking were strong. It's just that the benefits of higher intensity walking were stronger. So there's a two-barreled response to that question. Is one, Jess and I would both like to take on the challenge as clinicians of finding you an exercise where you can challenge yourself aerobically. And we're not saying that we can for everybody, but I would be pretty confident that for most people, and Jess, you can add to this if you like, but for most people, I'd be able to find an exercise where they can challenge their cardiovascular system. It might need a little bit of equipment, might be something slightly different, but most of the time we can find a way.
Yeah, definitely.
The other thing to add to that, just as I think, is that we're talking a lot about the cardiovascular benefits of cardiovascular training, but there are huge cardiovascular benefits of strength training as well. And so if you can't do the cardiovascular training that you would like, but you can do strength training twice a week, well, maybe you might be one of the members of the population where we suggested it's probably worthwhile you doing 3 strength training sessions a week, and then replacing what you were previously doing in one of your cardio ones. So there's always a way around it. It's not like your heart is asleep during strength training. Your heart's still getting challenged. Like we've all felt the buildup of lactate in our systems. And the only way to clear that is for your heart to pump more blood to the area and then pump it straight back out again. JB, next question from Suzanne. Can I work on rehab and increasing fitness at the same time?
Yes, absolutely. So rehab, that might be a small little corrector exercises depending what you're rehabbing. And then finding, like Tim said, there's various ways to get that, I guess, conditioning or higher intensity exercise or cardiovascular effect as well. So finding something that is appropriate for you that can get your heart rate up.
JB, is body weight training just as effective as lifting weights?
It's good. It's not quite as effective. Yeah, you can get a really good workout from body weight. I've been doing some telehealth sessions with a few clients who can't come into centre for various reasons, and doing stuff with body weight, they're actually quite surprised at how much they can get a workout from. A few are pretty skeptical to begin with. But overall, getting on the machines, getting that increased load and something that you can progress and build on as you start to, I guess, adapt and get stronger is really unparalleled.
Yeah, I think there's also an element of safety that comes with our equipment as well. You know, for anyone who's been into a Keizer facility, we've got, you know, a huge amount of floor space. It'll be really easy for us to open up some floor space if we thought that was the most appropriate thing. But we really pride ourselves on building a safe environment. So if you've got osteoporosis, if you've got arthritis, if you're coming back from surgery, you should be able to hop on the right pieces of equipment and feel safe. So I know as a physio that I'm very comfortable with people doing home exercise programs. But if I'm managing someone's pathology, there is a point at which I won't increase their intensity because I'm concerned about their pathology. And that usually comes down to their technique being compromised at a certain point of intensity or a certain point of load. Whereas, you know, I have people after back surgery or people after knee surgery working absolutely to 10 out of 10 in their intensity when they're on pieces of equipment under supervision of people like Jess, because of the trust I have in Jess and in our equipment as well. Jess, we've got a really good one from Jenny about any clues for arthritis sufferers on how to manage unpredictable flare-ups that we get. And you and I both know that so many people who come into Keizer and so many of the Australian adult population are dealing with arthritis to some degree. So do you want to start with just like a little bit of background on what arthritis is and then how people could kind of manage their way through a flare-up?
I think you're probably better one to describe this one, Tim, from a physio perspective. I'll let you carry on with that one.
Okay, great handball, JB. I feel like you needed a break. Take a glass of water, have a little drink. So arthritis is a condition affecting the cartilage, usually of weight-bearing joints. So typically knees and hips would be the two most common ones. Does apply to the rest of the body, but mainly those two. And it does appear to be an inflammatory condition and can be highly variable. So we don't look super closely at x-rays and films in arthritis. We always look at them, but we judge someone on their clinical picture and how they walk into our office rather than just in the films, because you can have really bad films but still be walking and running. You have really good films and have heaps of pain. For people who have arthritis, you should still continue to exercise even when you have some levels of pain and not expect that you would ever exercise pain-free. But I think, and here's the most important point, is don't think that pain is in any way a reflection of the damage that you're doing to your joint. And this is the discussion I have with my clients all the time. They just think pain, something's tearing, something's breaking, something's bleeding inside the joint. It's not that at all. When pain's working well, it's simply a protective mechanism. It's like a warning to you saying, do you want to continue this? If you continue this, something bad might happen. So that's why as physios in arthritis, we're quite happy for people to work through pain. But it's very specific to the person. So some people will come to me and I'll say, and they'll describe their pain, where it is, the nature of the pain, the intensity of it, when it comes on, how long it takes to go away. And I'll say, Jess, I'm happy for you to work through that pain until it gets to 5 out of 10. And there are other people who will describe a slightly different pain, maybe a different location, maybe a different pattern or behavior. And I'll say, as soon as that appears, you need to stop your exercise. Which is not particularly helpful for you, Jenny, because I don't know everything about your pain, but it's worth asking the question of your clinician, of the physio that you see, whether they be a Kaiser physio or not, to say, well, for me, what level of pain is acceptable? When should I push and when shouldn't I? Yes, sometimes no pain, no gain is true. And sometimes it's absolutely false as well. So it's a case-by-case basis. Definitely worth asking the question. Jess, John Shortridge wants to know travel tips to New Zealand. No, sorry. He's going to New Zealand next year if he's allowed to. And he's been walking, carrying a backpack with a pile of books in it. He doesn't say what type of books they are, what the topic is. Hoping to prepare for pack carrying. How useful is this? You're a New Zealander. You have been tramping across your continent a couple of times. Tell us about this walking experience, Jess.
Yeah, grew up doing a lot of tramping rather than the Australian hiking. Really good. Essentially, it comes down to conditioning. So if you're going to be out tramping or hiking for hours on end and you haven't picked up a pack before that's, heavier than your drink bottle, you're going to find that really, really tough. So conditioning to that, putting your books in there, maybe it's even doing a test run with, if you're going to stay overnight, your sleeping bag, your pots and your food and all that sort of stuff, that you can practice that weight. And I know the worst thing going on a hike is not being prepared for it, and you've got your blisters in your shoes and you've got the pack strap marks and all that stuff. So being prepared. So it will be a really good test, and hope you have fun.
Yeah. I hope I can go to New Zealand and go tramping across the continent as well. Jess, this one isn't a question. Did I ask you I'll give you your next question. Can I work on fitness and rehab at the same time? Did I ask you that question already?
Yeah, I think so. Yeah.
Sorry, I'll find another one in a second. But Chris just shared a really interesting story, which I think kind of goes hand in hand with my discussion about arthritis before. It says, Jess and Tim, just a comment. Thank you. That's very nice of you, Chris. No worries. I too have been walking more as a result of not being able to attend Kaiser to complete my normal program. Hopefully we can open up soon for you, Chris. At first, my knees were sore due to the walking. However, I increased the distance from 2.5 Ks to between 5 and 9 kilometers. And the intensity, and I found that the knee pain has resolved itself, and I found my cardiovascular fitness has improved along with my leg strength, which is an awesome story, a great story, and just testament to the fact that you shouldn't book in to see a physio the first time that you have any pain anywhere in your body, because often, not always, but if you give your body time to adapt, and you gradually load up, and Chris, I hope you gradually went from 1K to 2Ks to 3 to 4 to 5 and made your way up to 9, that often your body can respond. And people say to me sometimes, I'm too old to walk as far as I did before, and I can't do this that I used to do before. And I'm adamant that you can. You just need to take time to build up to it. And people are really surprised about the results that they can achieve through gradually increasing their strength over time. Jess, I'm going to find one more question for you.
Georgia.
There is a question there from Georgia about my shoes that nobody else of the 200 people here would like to hear about. We've done that one on arthritis. Oh, Jess, this is a really good one. They were the first 2 questions that we got. And we've had a fair bit of a chat about this up here at Kaiser in Pymble. So happy for you to throw this one back to me if you like. But comments on masks. They're going to become part of our lives going forward. So walking is harder in masks. And does that increase my intensity?
Yes. Walking in masks is a little bit harder. Particularly I found that the cloth mask obviously a little less breathable. So I know that if I'm trying to do a really hard walk, I'm making sure I've got my surgical mask on there that does give you a little bit more, I guess, room to breathe, I find. If we reflect on the intensity or the talk test, yes, it's going to make that talking or singing, I guess, a little bit harder, a little bit sooner. I don't know, I'm a little bit conflicted with the reason, like, yeah, it's just something we have to kind of deal with, and it becomes an extra layer of, I guess, conditioning, or that's how I'm looking at it from my perspective anyway. What have you been talking about in Sydney about it?
So it depends very much on the mask that you wear. So a really thin single layer mask won't trap much air and it'll allow you to breathe in and out almost normally. And the other end of the spectrum, you have a sealed mask where you're only able to breathe through a really small area. And it does a couple of different things. It increases your resistance to breathing. So it's actually a training methodology for your muscles of respiration. So in some ways, that could potentially be a good thing. It increases the heat because it doesn't allow the humidified air that you breathe out to get out and disperse. So you feel like you're breathing in rehumidified air. Quite good for someone who's got asthma and can be helpful to help keep your airways open. But if you're going for a walk and you're doing exercise, it's going to make you feel a little bit hotter and a little bit sweatier. And anybody who wears glasses will know about that for sure. But the big reason that sealed masks compared to small masks make a difference is that the amount of air that it traps. So you have only a portion of the air that you breathe in that actually gets absorbed into your airways. And a lot of it, there's no absorption that happens in your mouth. There's no absorption that happens in your neck. It's right down in the alveoli of your lungs. And so we call that anatomical dead space. It's where you're not getting any air exchange, any gaseous exchange. And if you wear a mask, it just increases that. So it means that instead of having to breathe in, say it's a liter to get all the way down to the bottom of my alveoli in my lungs, I have to breathe in 1.1 liters. And if I've got a sealed mask, I might have to breathe in 1.25 liters. So all of a sudden my breath needs to be a bit deeper. Everything's going to be a little bit harder. So there is some science behind why wearing a mask is harder and it will make things more intense. But really simply, all you need to do is just slow your walk down a little bit. Slow your walk down and try and match the same intensity that you were walking at previously. You may not be as comfortable because you're a bit warmer, but you'll be able to match the same intensity. No problem. So Jess, we've just ticked over 8:02. There's a couple more questions there, but we will you and I will get a copy of this and we might have a chat tomorrow and just go through all of those questions, make sure that everything is answered. But thank you so much, Jess, on behalf of everybody who tuned in tonight. Everyone found it really informative. That's probably the most questions that we've ever had. And to be able to have a little bit of to and fro and a little bit of banter with all of our participants is fantastic. So thank you for the work you did. Thank you very much for your expertise.
Cool, thank you. Thanks everyone for coming. It was awesome. See some familiar names and some new ones too, but no, it's good.
Thank you everyone for attending this webinar. We hope that you enjoyed it and we look forward to seeing you at another one soon.